Work.
Let's get started. For those of you who are not, everybody has been here frequently. I'm Katie Warren, and Joel Ryan is also here from the Head Start ECAP Association. We do this meeting every 2 weeks to check in with family support workers in ECAP and Head Start, early ECAP. And share information and get advice from each other. This time we have a special guest, Claire Lane, who is the director of the Anti-Hunger and Nutrition Coalition. And she is going to be here to talk about where we are on pandemic EBT for children 0 to 5. I also want to mention we have a few. This issue has come up a few times in the last couple of weeks, and so we also have a couple people on here from DCYF. Ray Soriano and Jen Anderson and Grace Segubuayo. I'm sorry, Grace. I should just say Grace. And then I also invited some folks from Building Changes, which is the homeless advocacy group, because they were trying to track some of this information down as well. Since we are have a guest, I would love it if everybody could go into the chat and put your name, where you're from or your program, and maybe put in what fun thing are you going to do this weekend. And Claire, I will let you take it away.
It is so good to be back with you. It's been a while. It's been actually since the first round of pandemic EBT. Yes, I do need to get a haircut. It's crazy long. So I'm the director of the Anti-Hunger Nutrition Coalition. We work on state and federal policy advocacy and administrative advocacy, working with state agencies. It has been quite a week or two between state and federal issues, so I'm super excited to talk to you guys. And as a former Head Start teacher, I love talking to you guys. So thank you for everything you've been doing. I know literally exactly how hard your jobs are, and I really appreciate everything you've done. So, pandemic EBT. EBT card that families can buy food with. In the first round of COVID relief that Congress approved, it was just for school-age kids. And it was designed to cover kids who missed school last year and give them essentially the equivalent value of what the value of those school meals would be on a card where families could buy groceries, just the way they use food stamps. We all knew at the time that completely left out the kinds of kids you guys work with, those 0 to 6 kids who might not be enrolled in school or in a school program that serves those preschoolers school lunch. And we know they were just as disrupted last spring and this fall. So Congress, when they approved the first round of COVID relief this fall, not the first round, I think it was the third or fourth round, they included pandemic EBT eligibility for preschool age kids. There had been a whole process writing a bill, and the bill language was really good and clear and awesome for those 0 to 6. But because the way Congress approved it, it was in that budget deal, and they used a continuing resolution. It's a different process than passing actually a COVID relief package. They had to squeeze those little kids in a way that didn't allow them to use the clear bill language, and it got really confused. So what the language at the end of September said, and some of this is still true, that for kids 0 to 6, and they include those 5 to 6-year-olds, because we know that there are little kids who aren't old enough to enroll in kindergarten and they stay, so it's the 0 to 6 for the kids who are not enrolled in kindergarten or enrolled in a preschool program at a school that serves them school lunch. So that's the age and sort of general eligibility. What Congress said at the end of September was for those 0 to 6-year-olds whose families are on food stamps, those kids can be eligible for pandemic EBT if they've had a disruption in their childcare. So that's two important criteria. One is those 0 to 6-year-olds, those preschool age little ones, have to be in a household that's getting food stamps. So it's a very distinct subset of preschool age kids. And those little kids have had to have some disruption to their childcare. Well, we all know, which apparently Congress doesn't, there is no way to track all kids in childcare and see what their schedule has been since COVID. It's literally impossible in every state. And USDA heard very quickly that this was going to be virtually impossible to verify individual kids' childcare schedules and how that might have changed since COVID. So the National Head Start Association was working with organizations like the Food Research and Action Center and other anti-hunger advocates to help get clarification on how states would possibly do this. And it went around and around and around. And we expected that there would be some guidance from USDA in mid-December. And it didn't happen. And as soon as that didn't happen in mid-December, it's like everybody at USDA left for the holidays. And then, yes, and childcare does include Head Start. It's like everybody in USDA like left for the holidays and then left their jobs, and there was no one left in the building until the new administration. I mean, not really, but it felt that way. And we knew there wasn't going to be guidance. So literally, USDA didn't give any guidance to states until after January 20th on even what kinds of ways that states could figure out eligibility for kids. So Washington has not yet submitted a plan for preschool age kids. So this is actually a really great opportunity for me to talk to you all, because I'm going to be talking to DSHS and OSPI about some recommendations for how we can use the language Congress did give us to simplify this process. And we now actually have, well, one state we really like their plan. 2 states at least have been approved for preschool age kids. Indiana, which is not a great plan. We don't really want their plan. But surprisingly, Arizona has been approved and their plan is awesome. So I want to talk a little bit about what it's going to be like for preschool age kids. And then I want to tell you what the plan is for school age kids, because I know that the families you guys serve, lots of those families have school age kids. So I want to give folks a little heads up on what's to come for those families' older kids. But on the preschool side, and I'm just using preschool as an age category, like whatever's before they're enrolled in kindergarten. Again, it does have to be families that are enrolled in food stamp or kids that are in a household that gets food stamps. So I want to be clear about that. That's been clarification that my colleague in Massachusetts has made, because we know there are some kids in like kinship care situations where they may be in a household where they may not be directly on that family's food stamp eligibility or their application, their program, but they're living in that household. And we think those kids should be eligible.
Can I ask you a couple of questions, Claire? Yeah. One is Cammie has asked to confirm that childcare includes Head Start and ECAP.
Yes, it does.
And then the other question I had was that I think we have a state program that provides an analog to food stamps to undocumented children. If so, would they not be qualified then for this?
So we do have a state fund. We are the first state in the country. Our state food stamp lookalike program for legally residing immigrants does cover them. It is not for undocumented families or kids. It is, you have to be legally residing. This was created in the mid 90s when Congress changed eligibility for food stamps for immigrants. What Congress at the time had said, if a family, if someone has been in the country legally residing, but for less than 5 years, they would no longer be eligible for food stamps. Washington State at the time, Governor Gary Locke was governor, and it helped. Representation matters, right? The child of immigrants basically said, no, that's not how we're doing it in Washington. We're going to create our own state program that is exactly a mirror of the federal program. So it's the same application, it's the same screening, it's the same card, it's the same everything. But if you're a family where, say you have 2 citizen kids and a parent who's been in the country for 10 years and another parent who's been in the country for 2 years, the 2 citizen kids and the parent who's been here 10 years, those food stamp benefits get paid by the federal government. And that parent who's been here for only 2 years, those benefits get paid for by our state budget.
That's not complicated at all.
Well, here's the thing. It is only complicated for DSHS. Families don't ever know that this is how it works.
So Claire, for those kiddos who fall into that situation, like maybe they've been here for less than 5 years, are they going to be eligible for pandemic EBT?
Yes.
Okay, good.
Yes.
But undocumented children would not be, and so we need to figure out another way to pick up the slack there.
Yes, exactly.
Okay. Thank you.
Katie, can I ask a question to Claire? Claire, in the last EBT pandemic, the undocumented kids were eligible for it, as long as maybe Janet will know more because she did have some families that they applied, and the kids that were undocumented, as long as they were in a school, they were eligible for the pandemic for the EBT.
Yes, and that is still true for school age kids, right? So this is the difference, right? For school age kids, they just need to be eligible for free or reduced price school meals. And that has not any child who meets the income guidelines. There is no citizenship or documentation requirements at all for school meals. So if a child or their family is undocumented, they are absolutely, and we should right now encourage all of those families to apply for school meals because they are eligible. It has never been a public charge. This administration was rolling back all those public charge pieces. So citizenship, immigration status, documentation does not matter. They do not ask on a school meal application, and those kids are all eligible for free or reduced price school meals. Unfortunately, for those preschool age kids, Congress wrote their language to say preschool age kids whose families are on get food stamps and have had a disruption in childcare are eligible for PEBT. So it's super lousy. Don't get me wrong. It's not great. Those preschool age kids have to be on food stamps to qualify. Their school age siblings can be undocumented as long as they're eligible for free or reduced price meals. The school age kids are eligible for PEBT. Does that make sense to folks?
So I have a question. If you, so if I am a family who did not apply for pandemic EBT or for school lunches for my older kiddo, if I apply now, would it be retroactive to September?
Yes.
Okay. And then we have a couple of questions in the chat here. One is there a link or written guidance on this information?
Yes, I will. It's not great. And again, yeah, let me pull it up when I'm done talking. There isn't written guidance. Well, yes, there is guidance from USDA for preschool age kids, but we don't have a state plan yet. So we don't know how.
We don't have our own rules yet. We can make a plan that is very generous and expansive, or we can make one that is going to give every single one of the folks on this call 5 hours of paperwork.
And we want to do the first and be like Arizona. So I want some feedback from you all about that.
Claire, who's the decision maker in this? Can you clarify that? Who makes the ultimate decision on what the guidance looks like and how it flows?
That's a very interesting question, Joel, because pandemic EBT was really created originally to replace school meals, but it uses an EBT card, just like food stamps. In every state, it is a partnership. It is a joint project between their state's K-12 agency, right? Their State Department of like OSPI, and DSHS. So DSHS, the state SNAP agency, has to be the one to submit the plan because ultimately they're the ones who have the relationship with the EBT card processor and because it functions like food stamp. So ultimately DSHS is guiding this process. For the school age kids, it's in deep partnership with OSPI. For the preschool age kids, it seems to be a mishmash, and those folks from DCYF might have a better sense of the conversations, but it seems to now be a conversation between DSHS, OSPI, and I think some guidance from DCYF, and that's what I want to ask about today.
So is there an expected date for the second EBT, and will providers be included? I'm not entirely sure what the second part of that question means. So Amy, if you want to clarify, that would be great.
Yes, we had heard that childcare providers were also going to be included in the second round of the EBT for the number of children they had enrolled, since they have more children in their care all day because of school being closed. So that was my question, if they will be included.
So you mean along the lines of what programs do and get CACFP, right, for the children who are in their care?
Yes.
I think this is separate, right?
So here's what I'm going to say about CACFP. I think at the end of September, when Congress passed their budget that had this sort of weird language, there was language in there about CACFP. And again, that started to open this whole unmanageable box, honestly, about which childcare, what kinds of childcare out there has been disrupted, and how many of those are actually on using CACFP. And it just became super complicated. And what USDA has now said is it really doesn't, like CACFP participation or provide, like none of that matters. We don't have to account for that. We don't have to think about that. That's way too complicated. So in federal jargon, what USDA and Congress has said is that states can use simplifying assumptions. You have to make a case for why this assumption about eligibility is reality-based, but it does not have to be exact. We can have some assumptions about kids that, our state needs to make a case for, but it can simplify eligibility and enrollment. And this is what Arizona has done. They have really simplified their assumptions that will make, honestly, more kids get more benefits and be significantly easier for the state to administer. And that is what we want for our preschool age kids in Washington. I have to say, it's not exactly what our state did for school age kids. I would have simplified it much more, and lots of states did, but nobody asked me.
So just to clarify,
CACFP.
So just to clarify, this is an individual benefit that goes direct to the family. And So the provider is not actually getting any money from this fund.
Correct. This is for families to buy groceries at the store.
Right.
And they can still continue to get grab and go meals from their school. They can still get meals from their childcare. This is only for kids, preschool age kids whose families get food stamps, where there has been, and this is where the simplifying assumption can come in, where we can assume they have had some disruption in their childcare.
Yeah. So before we get to that question of disruption, which is the next question down there, Maria asked, she said last year our 4-year-old preschool did not get the pandemic EBT and they were getting district lunch. Maria, do you mean you have a preschooler and you didn't get the pandemic EBT, or do you mean that your program did not qualify for this? Because we can troubleshoot that later, I'm sure.
Katie?
Yep.
Can I share our experience in our center? It was kind of tricky. If the child, if like we have sites, they are in the school district. So those kids, they were in preschool, but they were in the building, and the school district, you know, files. Those kids did get the pandemic EBT.
Yes.
The ones that were outside of the, you know, of the buildings didn't, like our Centralia College kids. They are not in the school building. They didn't qualify. And it's the same case right now. But the ones that were in, you know, in the school district buildings and they were part of the school district, they did get the pandemic EBT.
Yeah, and to be clear, this really came up a lot last fall, because even if you were in the school building, if you weren't getting your food through the school district free and reduced lunch program, but your classroom was in the school, but you were using CACFP, those children would not qualify for pandemic EBT.
And most of our parents had to call and add that child to the, you know, the extra help.
So here's the question. Those school-based programs, do they use CACFP or do they get school breakfast and national school lunch?
It varies from school to school, Claire.
So here's my question for you all. If you know of a program that is located in a school building, and those kids get school breakfast and national school lunch, not CACFP, but the regular school meals, I'm going to put my contact information a couple times in here. I really want you to email me, because we know the eligibility, as Katie said, really had to be those kids that get national school lunch. And unfortunately, because again, our state didn't write a very carefully thought through plan, they cut off the age of eligibility at 5, even though we know that there were 4-year-olds and potentially 3-year-olds in Head Start and ECAP classrooms that were getting national school lunch, but they were sort of, the state didn't think about it or something. I don't really know how this happened, but they cut off, but based on those kids' age, not based on whether they were getting national school lunch or not. So if you have a program where those kids last year or this year are getting national school lunch, not CACFP, please contact me. Because I want to make the case of other things that we amend our state plan and we serve those kids.
Okay, so let's talk a little bit about this issue of disruption and what kind of thing we're, you know, what kind of information you need to make the case.
So I'm going to give you some examples that I've been hearing from other states and how they're trying to approach this. And I want to know from you all what this would mean. So for example, Arizona's plan is saying if a child is their household is getting SNAP and they live in a county where at least one district has had a closure and kids are learning remotely at all of those kids will get PEBT. Any preschool kid that lives in that county will get PEBT. Because the simplifying assumption they're using is that if our school district has had some kind of closure, we can assume that there are childcare that has been closed or reduced. So for example, if you're, if you're in a county where at least one district has been all remote until now, we can assume that that means there's been disruptions to childcare. And so kids in that county would be eligible for PEBT.
So Claire, Betty brings up a good question here. So we have all of these virtual families, or even our hybrid families, right, who have had some disruption with their childcare, but they may be receiving porch drop school lunches and things like that. So would they still qualify?
It doesn't matter if families are getting meals in any way right now. It is really about whether there is some disruption, whether it's any kind of disruption from how kids are getting meals through their programs or their schools. So for the school age kids, if I could just go for a moment of how our state plan is working for school age kids, it is basically saying schools have to report their schedule. How many days a week each month are the majority of kids in person and getting a meal as part of their school day? So if you have a grade school where K through 2 is in school twice a week and getting a lunch while they're there, those kids would get PEBT for the 3 days they're not there and not getting a lunch as part of their school day. But if that school has their K through 3rd graders there on campus, but for only 2 hours, and they're sending kids home with a lunch and a breakfast, they're eligible for 5 days worth of PEBT because the meals they're giving is not part of their school day. It's not part of their instruction. They're sending them home. Similarly, if a family is getting a porch drop or they're going and picking up meals, that is a totally different thing. Families are encouraged and should be getting those meals, but they are also eligible for PEBT benefits.
Yeah, and the record keeping as described sounded like a complete nightmare and also kind of inequitable the way that it can shake out.
Which is why we want to use very simplified assumptions for those preschool age kids, because we don't want this to be a whole matter of a lot of complicating tracking of schedules and hours. And honestly, my concern right now, and I haven't had an opportunity to talk to OSPI or DSHS or DCYF about what the conversation is now. What I don't want is that our state plan for preschool age kids would follow the plan for school age kids.
Yeah, so here's another question for you. So, we are, certainly in the fall, we were 90% remote. Today, we are only 70%. We're 70% at least partially in person, right? Even if it's a hybrid. So what does that mean in terms of are we going to have a different amount for November than we have for February? What does that look like?
Yes. So I think this is also going to get at the question that folks are asking about how do we prove disruption and what does that look like? Okay, so the other thing I realized I haven't said yet, unlike last year, no one, not even school age kids, are going to have to apply for PEBT. Families will get these benefits automatically issued to them. This is, I think, part of why Congress gave that eligibility criteria around a family who's getting food stamps now, because that's a universe they can identify. There's a system already to issue them cards. That is easier. And it doesn't require, so no one will have to apply for PEBT, not preschool kids and not school age kids. So I want to be clear about that. The state has to submit a plan to USDA that they approve, and that plan will be automatically issuing cards and benefits to eligible families. Now, Congress has been clear, and so has USDA, that, how do I explain this clearly? Because it's taken so long for every state, not just Washington, honestly, every state is just now getting their initial plans approved. So what's going to happen is the first round of benefits that go out for kids, and for preschool age kids, the eligibility starts October 1st, not the beginning of the school year. It's going to be October 1st, which is the beginning of the new federal fiscal year. It's a continuing resolution budget issue. So starting October 1st through to whenever they issue the first round of benefits, right now, what they're talking for school age kids, it'll be from the beginning of the school year through January. Families will get that first sort of lump of PEBT benefits sometime, hopefully at the end of this month. And then after that, they'll get it every 2 months, because Congress has said, and USDA has said, every 2 months, the state needs to check with schools and make sure that their schedules haven't changed. Because again, this is this idea of meals that kids are missing for when they're actually in school. And as we know, right, there are way more schools, and I imagine childcares, that are open now at some level that weren't in October. So as more schools and childcares reopen more, kids would be eligible for less PEBT, because the assumption is they're getting meals in school and in childcare. But this is where we have to talk about what is disruption and how do we frame this to give the maximum benefit to kids and families. So for Arizona, they are proving disruption because they are looking at the districts in a given county and saying, if there is a district that is all remote, we should assume that there are kids in childcare in that county that have had to essentially have a complete disruption to their childcare. And so those kids, if there is any district in their county that has been all remote, those preschool age kids should get the full sort of all remote benefit. If there is no district in your county that has been all remote, according to Arizona, you next look for a district that has had reduced hours, reduced attendance. So maybe they're only bringing K through second and special ed kids to school twice a week. Then we can assume that that most minimal schedule is what we can sort of assign to childcare. That if there's that level of sort of reduced attendance for school, we can assume the same level of reduced attendance at childcare. By that measure, we only have to look at any district in a county. We only have to look at 39 counties. We do not have to get individual school building data and schedules the way they're doing for school age kids, and it would simplify it. And part of how Arizona explained this to USDA as a reasonable assumption is both it simplifies it for the state because it gets too complicated to try and assign every single child to a particular school district or school building, because we all know families, their kids are in childcare. Childcare is not necessarily their closest school. It's not necessarily related to their neighborhood school. Childcare works really differently than school assignments. And so using a county level measure more accurately reflects the reality for preschool and childcare, the way it works for families. I would love if our state could use Arizona's plan because it's simple and it's more expansive. What I would not love to see, just for the record, personally, Claire, I would not love to see what Indiana's doing, which is they are taking all of those 0 to 6-year-olds on SNAP who are not enrolled in a school and saying, we're going to look at their zip code, look up the school in that zip code, and make those preschoolers follow the same benefit schedule as their local school. Because for ways I'm not even going to explain, as Katie said, I had to explain it to her like 3 times on how they're calculating this like hybrid schedule, majority of kids, blah, blah, blah. It's very complicated and it's not particularly equitable.
So I think that, it's not too difficult to prove disruption for our Head Start and ECAP kids because we know our schedules, right? But I do worry about all those kiddos who are on SNAP who might have used to go to Aunt May's house, and I want all of those kids on SNAP to get this benefit, whether they're in a formalized care or not. Is that also an element of this? And we want actually all of our Head Start and ECAP kids who have littler kids also to get benefit for that littler kid as well, right?
Right. I mean, that's where when you think about the criteria, it's limiting, right? Especially when we talk about immigrants, particularly when we talk about undocumented folks, that if we talk about starting with this universe of preschool age kids as just being those kids whose families get food stamps, it's a much, much smaller universe than low income preschool age kids. We know that, but that's what Congress has said. So we know we have to operate just at that level of 0 to 6 whose families are getting food stamps now.
So what if Joel actually asked, so what if I'm a parent who hasn't been getting food stamps, but maybe I qualify for it? If I apply for food stamps now, would that mean that I'm only eligible for the PEBT from when I start getting it, or would there be a retroactive thing, or what?
We don't have a plan for our state yet for the preschool age kids. So I think this is a really good question. And I think we should be really strong advocates with our state agencies to say, for school age kids, what USDA is doing and what our state plan is doing is saying, if a family becomes eligible at any point this school year for free or reduced price meals, whether because they fill out an application or they enroll in food stamps or TANF or whatever, they are going to be eligible for the full year. I think we should say the same thing for preschool age kids, that those families who, because the universe is only kids enrolled whose families are on food stamps, we should have that mirrored eligibility timeline. That if they enrolled at any point in this school year, they should be retroactively eligible. I think we should make it a request to our state agency that that's how we build our state plan. What do you guys think?
I am in total agreement, Claire. You know
Yeah,
that
we're
you
in
and
total
I are
agreement with you.
completely copacetic on these topics.
Who do we send who do we say we agree with this to? That's should we send Babs or something, or who's in charge of this?
I'm going to follow up with some of you, and Ray, I'd love your email in the chat. I think I might have it somewhere, but it'd be super helpful.
I copied Ray. I copied Ray and
yeah,
Carrie in. So Claire, what kind of information would you like from all of these great family support folks about their programs or their situation that might help you as you go into this meeting with DSHS next week?
So I think what would be helpful to know is, in your community, is there a significant difference between how you're serving kids and families compared to how you did before COVID, right? Have you reduced hours? Have you reduced days? Have you switched up schedules? How much have you changed? And how different is that from what your local school, not your district overall, but the school near your program, right? Because if the state theoretically could be proposing a plan that says, we're just going to assign every kid's family on food stamps to the same eligibility as their nearest school, I want to know how different is your program's sort of access and disruption from what your local school is doing.
Anybody want to weigh in? And I will say that I think that one of the ways that this might shake out is that people who are operating full day, full year ECAP or Head Start have been much more likely to be in place full time, right? So still serving children on site. That's a very small percentage of our children. And with part day and school day, I would say 100% of them have been disrupted in some way or another. But I would love for folks to put in the chat what your scenario is in your program, what's been the experience of your families. And Claire, we can also talk about, we can try to do a quick survey if that would be helpful to you. If you want to provide questions, we can send that out to the folks on this call and to ECAP and Head Start directors. So let me know if that would be helpful to you. I'm not entirely sure what the questions are, so you would need to guide me on that, but we have a Survey Monkey.
That would be super helpful. So I'm trying to read through the chat, and for some reason, the last couple of days, my chat scroll bar doesn't work easily, so I have to sort of find it. I want to answer a couple of these questions. I'm trying to figure out how to go back. So again, to be clear, there is no dollar limit on the federal funds that Washington or any other state is being allocated. This is basically a
entitlement.
Thank you. Not discretion. All I can think, it's not discretionary, it's an entitlement. If a family is on food stamps, they will automatically get the benefits once the state has this program in place. Families don't need to do anything additional to assure they get it. The only question now for states is to determine how much of a benefit do those families get. Right now, the value of a PEBT benefit for a day, for a family, for a day that's fully eligible is the value of a school breakfast, school lunch, and a snack. So it's a little bit higher than last year. It's $6.82 a day. So right now I did some rough calculations for school age kids. If you think about a district that was all remote from the beginning of the year through January, it's about $600 per child. So we're talking real money. Also, school age kids are each going to get their own PEBT card. So if you have 3 school age kids, that family is going to get 3 separate cards because, again, our state did not really simplify assumptions, and they're going to be going on the benefit level based on their individual child's school. So if you have a 1st grader and a 7th grader and a high schooler, they could have wildly different schedules. So those kids would each get different benefit amounts on their card. Someone asked if a family with school age and pre-K said don't qualify for food stamps, but they qualify for school meals. Those school age kids will get PEBT, but their pre-K kids won't because they're not enrolled in food stamps, but their school age kids will.
So I have a question about from some of the folks who are operating in person. Do you still have kiddos who are operating remotely, even though a lot of your kids are in person now? Anne says yes, she's in the Olympia area. Margaret only has one. Margaret only has 18 kids total though, so she has a pretty small program. Mary, yes, Mary's in Spokane. Trish, I can't remember where Trish is. Yeah, so that's another glitch here where we have some kids who are continuing to be remote, and then we have other kids who are coming hybrid, and then we may have other kids who are coming more like full-time, or at least, you know, the school day or something like that.
So again, this is why I think I really love Arizona's model, because what they have said is that childcare is not the same thing as school, right? Families need to work, they need care for their kids, and what you're doing with little teenies is not the same as school age kids, right? There's more options for kids, for older kids to be doing remote work than there obviously is for, you know, 4-year-olds who are not actually in school. They're in, you know, high quality pre-K that serves as both sort of childcare and education, but they're, you know, we're not trying to teach them math in 3. So I think the argument can be and should be made that a school schedule is not the same thing as the schedule for pre-K kids, because developmentally they have different needs and different realities. And following the schedule of your closest school is probably not reflective of what's happening for preschool age kids and families. And again, I'm not saying this just to say we should give the most amount of benefit to kids, though as an anti-hunger advocate, I strongly believe that. It is a simplifying assumption. The work that it would take to match every pre-K kid on food stamps with their local school and saying that that match is the most accurate reflection of what's happening for those families with preschool age kids is probably not accurate.
Yeah, Claire.
It's not simple, right? We're going to have to do all this data matching. If we can simply say, let's look to a district, if there is a, you know, sort of let's go to the highest common denominator, not the lowest common denominator, and apply that to kids in a county.
Yeah, you know, I think about this, you know, Antonia wrote that their enrollment has been affected a lot, and that's true across the state. We're about 80% full at the moment in ECAP and Head Start. But that actually means that a lot of families who normally would have been at a full day program and been able to work or go to school or whatever are now at home, and they I don't know whether if they've never been in a program, you could have rules that are restrictive enough to say that if you're not attached to a child care or an ECAP or a Head Start or whatever, then you wouldn't qualify. And so I'm really concerned about those families who wouldn't get that because they're in a freaking pandemic. And so they.
So again, I want to be really clear. No one in America is saying that we have to somehow connect those preschool age kids on SNAP with their actual childcare arrangement. That was what sort of the original bill led us to think, and it talked about CACFP. And everyone who knows anything about childcare in America said there's no way to track this. Partly because of informal, like kinship care, partly because, right? Who tracks the schedule of family-based care, let alone center-based care, let alone family-based? Like no one in America is tracking it by your childcare arrangement.
Yeah.
The only thing that states are having to do is somehow make some kind of justification for how much benefit those kids would get.
Okay, I see.
And that is where you have to prove some disruption in childcare without having to actually tie it to a family-specific childcare arrangement. This is the simplifying assumption. So states are basically sort of saying, how can we use whatever assumption we're using around school and use it for preschool age kids and call it good?
What if our simplifying thing is that we have had sort of state sanctioned lockdowns and restrictions? I mean, that's
honestly, and this is a question, you know, that I want to ask you all, and this could be part of this informal survey, but you know, we on the this national group of advocates that I've been on a weekly PEBT call since last spring, just for the record, because this is how complicated it's been for every state. There are some states who are trying to say, if there is statewide guidance from their governor about childcare, let's use that guidance to make the assumption that every child's had some disruption, meaning, limiting capacity, social distancing, whatever those statewide guide. Now, I don't know that USDA is actually going to approve here. This is the state guidance for childcare. Therefore, the entire state is eligible this way. That's probably not as likely, but maybe there is county level guidance from your public health department. And I would love to know if DCYF is tracking county level guidance for childcare that would demonstrate that there has had to be some restriction and participation in childcare, because either they have to lower capacity, they have to increase distance, they have whatever those needs. We could maybe do that at the county level and say this county level guidance is our assumption. We're using this to assume families have had disruptions in care.
So for those of you out there who have service areas that cover different counties, are you getting different guidance from county to county around what your restrictions for in-person services are? Yes. Mary is with the ESD over in Spokane, and they cover multiple counties in that area. So maybe that's another question that we might want to ask in our survey, Claire, something about that. Not everybody's going to know the answer to that question, but we can certainly ask it.
Yeah, and maybe a request to DCYF. If you guys have done some sort of survey, or you have sort of gathered state, county level guidance, that would be super helpful.
So, I mean, the other piece for a lot of people is that the disruption has been we haven't been able to get into the buildings because the schools have been shut down. So there is an analog to the school schedule in that respect in many cases, but not in all.
Yeah.
Is there a maximum amount that an entire family can receive?
So I just, yes, but that is really only based on how the state has decided they're going to calculate benefits, right? So the maximum you can receive is $6.82 a day that a child would be eligible for PEBT, and how we calculate that eligibility is going to be based on that, sort of how many days a week is a kid eligible. Again, in Arizona, with their broadly simplifying assumption is, in some counties, kids would get $6.82 5 days a week for the 4 weeks a month, because there is a district that is all remote. In other cases, if kids are in session no more than 2 days a week in the school, then kids would be eligible for that $6.82 a day for the 3 days a week that kids are not in school. Does that make sense?
Yeah.
So the maximum is really set about how we're determining eligibility for a PEBT eligible day. That's what someone yesterday was calling it. I was like, I like that, a PEBT eligible day.
Okay.
Other questions from the chat? I know this has been a lot.
Yeah, so Mary says there's smart sheet recording. I don't know what all that
I know
I'm not what all they ask you in that. What happens if there are different school districts doing different remote learning models for different grades in the same county?
For sure, and that is happening all over the state. And what Arizona basically said is, we're going to take the most shut down schedule and apply that to all kids.
Yeah.
And USDA approved that. They basically said, if anywhere in our county there's a district that is all remote, that's the one we're going to use. If we don't have one that's all remote, we're going to basically take the one that has serving kids the least number of days and use that one.
So Claire, I think we're going to wrap it up here. And so in terms of next steps, if you would like to do some sort of a survey, send me the questions, we'll set it up and send it out. Happy to do that. If there are other advocacy things that you would like us to do, if you want us to make a big stink at DSHS, you know, Joel loves to do that.
We love stink. Yeah, that's our expertise. You just point me in the right direction, Claire, and I'll
be
join
in touch.
the stink parade.
I'm hoping that for preschool age kids, we don't have to have a stink. And unfortunately, the stink was for school age kids, and then that ship sailed. I will say one last thing. Here's an advocacy that has nothing to do with PEBT, but it is a great advocacy opportunity at the state level. So, right, we're now talking about meals and access to meals. Next Wednesday, in the Senate K-12 committee, they are going to hear House Bill 1342 that would eliminate the copay for school lunch for school age kids permanently for all kids.
Great. Yeah.
That is
Great.
perfect.
Very influential voices. Contact your senators, make sure they know that this bill is being heard and that you support it.
Well, we should
Claire?
get some of our past parent ambassadors on that one, because that actually just came up in the chat with our past parent ambassador web group. And so, yeah, that's a great idea.
Yeah, we'd love to help you. I would just mention, if you end up finding people you need to sign in support of that, you're more than welcome to sign our organization in support of that bill.
Thank you. I'll be
Great.
in touch.
And oh, I love putting people on panels, Claire. You know I do. So
We will be happy to find.
So I just want to say thank you guys for giving me an entire hour to talk about PEBT. It is complicated and we're really hoping to make it simple. I want to answer one last question that I saw going in the chat. So, because this is again the complication to explain to families, they are going to get one lump sum to start, and then they're going to get it in a regular payment every 2 months. So they're not going to do it monthly because they don't have to, like states have to sort of recheck their school schedules or whatever every 2 months, which is better than every month. That's simplifying for everybody. So I think it will be important to explain to families, you're going to get a lot of money when this happens. You're going to get a lot of money at once. You are not going to get the same amount every time in the future, especially if those school schedule or however we calculate this changes. But that's going to be important to understand. It's going to be one lump sum because we haven't figured this out starting back from when families are eligible, but then it will be every 2 months.
Great. Thank you.
My contact information, call me, email me. I am happy to answer questions. And Katie and Joel, I'll send you some questions for a simple survey.
Yeah, and follow up with the bill information too, and we will pass that on and find you some testifiers if you need them.
Thank you.
All right. Thank you guys. Thank you everybody for being here. This meeting happens every 2 weeks, so feel free to join us for days when we just talk to each other instead of to a special guest. So everybody have a great weekend.
Thank you,
Take care,
Katie.
everybody.
Thank you, Joel.
You're
Bye.
welcome. Take care.
Thanks, everybody. Thanks, Claire.
Bye, guys.
Bye.